Good afternoon, everyone, and start with just a little reminder. Sorry, I try to keep louder. So, as Peter mentioned in his presentation, a systematic review aims to collect all available evidence on a specific scientific question by providing a narrative summary of findings, while meta-analysis applies a similar approach but attempts to synthesize new evidence from collected data with statistical methods. So, systematic review is a quantitative synthesis, while a meta-analysis is a quantitative synthesis. And why we would like to perform a meta-analysis or a systematic review? Because it's exciting and it's funny to do it, and maybe we would like to elevate the number of publication in our CV. But nevertheless, and most importantly, I would like to highlight that systematic review and meta-analysis can provide the most robust evidence for science. Which topics should be subjected for a meta-analysis or systematic review? Choose those topics which answer relevance in practice. It can be a clinical practice or basic science practice as well. Important and novel issue, CV question, scientific community calls for it. So, for example, in a conference when you attend, everybody is, so most of our presentations are about the most hot topics, and you can find that subject which is important for the scientific community. Inspire new research and fill the gaps in guidelines. How can we get inspired from a good scientific question? We can use our everyday practice and our everyday problems, mainstream topics from the field of interest. We can check guidelines, where can we find weak recommendations or missing statements, and we can check the clinical trial registries, and we get inspired. What is the PICO framework? This can help us to perform a well-characterized scientific question. This means we have to identify our population, what kind of intervention we would like to compare to another intervention, for example, and what are the main outcomes. So let's see this question. What is the cause of type 2 diabetes? This is a really nice question, but it looks like a question from a textbook from our university years. So it's a background question, and if you can see here, it's not good for the PICO format. Somehow, it's not a good question for performing a meta-analysis. Let's correct this question like this. Does obesity cause type 2 diabetes? This is a better question. We can do it in a PICO. So patient population is type 2 diabetes. Intervention here will be obesity compared to those ones who are not obese, and the outcome is the incidence of diabetes. But we can do a better one with this problem. So, for example, this one. For the best prognosis, should we use metformin or metformin plus insulin in the treatment of advanced type of 2 diabetes in obesity? So, again, the patient population, obese patient with type 2 diabetes, we would like to treat them metformin, or we should treat them metformin plus insulin, and the outcome, the prognosis, so the better glycemic control, complications, and so on. But I have to highlight that you have to care with caution this kind of questions. So every question can be framed by the PICO format, but the answer is not always suitable for make conclusions. For example, in this example, what I mentioned previously, obesity and type 2 diabetes, we're performing a meta-analysis can't tell us the exact answer for which causes which one. The only conclusion which can be made from a meta-analysis based on this question is there any association between obesity and type 2 diabetes? Let's see some examples for typical questions which are good for meta-analysis. The best one and which one is easier to perform, it's about the treatment. Here is an example. In a patient with acute appendicitis, how is mortality and morbidity different if the patient is treated with appendectomy as compared with antibiotics alone? So let's check. The patient population will be patients with acute appendicitis, intervention to treat them antibiotics compared to the gold standard appendectomy, and the outcome morbidity and mortality. Let's see another one with the treatment and efficacy of the treatment. What is the efficacy of less than 1 year of adjuvant trastuzumab therapy in early stage HER2 positive breast cancer? So patients are with this type of breast cancer, short period of trastuzumab therapy compared to 1 year therapy, and the outcome will be the overall and disease survivor rate, hazard ratio, odds ratio. We can make questions about diagnostic tests. So here an example. What is the diagnostic accuracy of urea breath test, serology and stool antigen test used alone or in combination for diagnosis of Helicobacter pylori infection in symptomatic and asymptomatic people? So symptomatic and asymptomatic people, the patient population, and we compare urea breath test, the serology and stool antigen test, and the outcome will be the diagnosis of Helicobacter pylori. Incidence and prevalence, also an important and fascinating interest. There is a question: is celiac disease more common in children than in adults? So I have to mention here that always difficult to make a good PICO format for those kind of questions which are focusing on epidemiological data. So the global population intervention is the children to compare to adults, the prevalence of celiac disease. Protective and risk factors. Is there association between environmental toxic metal contaminants and cardiovascular diseases? So also we looking in the general population and looking for the environmental toxic contents and how its effect on the outcome of cardiovascular diseases, coronary diseases and stroke. When we try to figure out what kind of question we would like to ask and how detailed it should be, I give here an example. So we have to try to do our PICO question as detailed as it's possible, but avoid overcomplicating. So for example, just choose a mainstream hot topic, hypertension. I put it hypertension to PubMed and I have found this amount of result. And then I put the treatment of hypertension. This is also a hot topic. You can see here there are many results for this So it's missing here that mild and moderate hypertension treatment. So you can see that there are less results, why I am making wider the PICO question. You can see that if we are looking for hypertension in pregnancy, we can find less articles. And then if we are interested in a specific treatment of a pregnant woman with hypertension, you will, so our results will be wider. So it's in this pool we're gonna find those kind of randomized control trials or those data what are needed to answer our specific question. But if I make it more wider to a certain period of this pregnancy, there will be just a small amount of literature data which is not enough to perform a meta-analysis. So here I put that the Cochrane Database Systematic Review Working Group, the hypertension study group, they performed the meta-analysis on this specific question. Here another example for a meta-analysis. This is also a hot topic, and it's about the angiotensin converting enzyme inhibitors and the angiotensin receptor blockers. And it was also done by the hypertension group of the Cochrane database. And their question was, or they would like to examine the compare effect of AC inhibitors to IRB on total mortality and cardiovascular events and their rates of adverse events. So their PICO is really clear. The patient population is a primary patient with primary hypertension. The intervention is the angiotensin converting enzyme inhibitors compared to the angiotensin receptor blockers, and the outcomes are really clear: mortality, cardiovascular events, and adverse events. They conclude that no evidence of a difference in total morbidity or cardiovascular outcomes for IRBs as compared with AC inhibitors, while ARB caused slightly fewer adverse events than AC inhibitors. So it's a clear conclusion, and we can use it in our everyday practice. So we won't kill our patient if we choose ARB, and maybe it will be better for the coughing side effects. And in this article there is a really clear and nice quality of evidence statement, and it says that due to the bias, the evidence for total mortality was judged to be moderate, while evidence for total cardiovascular event was judged to be low by the grade approach. Here another example. This is about the coughing and about the medication against cough. I think here in the autumn time is also a fascinating and interesting question, in this article they want to know the overall effects of any kind of treatment for subacute coughing, and their PICO unfortunately was a mess. So the patient population was the patient with cough, and then they compared all kind of medications with everyone. So there were no clear and well-designed PICO in this meta-analysis. So not surprisingly, their conclusion is also questionable. So no treatment option was associated with a clear benefit on coughing recovery or other patient-revolved outcomes in any of the studies or in meta-analysis for coughing outcomes. So what they said is that don't use, or it's unnecessary to use this kind of medications because the cough won't be better. And it could be a misinterpretation of this kind of specific question. So however, the question or the topic is really interesting. Because the PICO format and the question was not well designed, the meta-analysis was not performed well, the conclusion is not correct. So, to sum up my presentation, PICO helps to clarify the problem in our mind, and PICO helps to build up a good search strategy, but not all PICOs can be answered by meta-analysis, and make your question as specific as possible, but do not overcomplicate it. Thank you for your attention.